Everybody for coming out. I got some really good information to share with you, and if you listen with your heart, it will help you and your family's health in a very positive way in the future. So before we look at the exercises, I want to just explain a little bit of a reason why we do the exercise, okay? So a lot of people come in here, most patients like you guys come in and you're in pain, and that's okay. We want to get you out of pain as quick as possible. The exercises are made to help you get out of pain, but they're also made to help you get your spine to as near to normal alignment as possible, okay? And so in order to get you to as near to normal as possible, we have to talk about what is normal. So if you looked at someone from the front, how would the spine be? Would it be straight or would it be curved? The spine from the front is straight, okay? That's okay, so when it does curve, what do we call that when it curves?
Out of alignment.
Scoliosis, out of alignment, right? Not good, unhealthy, incorrect, abnormal. But when you look at the spine from the side view, how does the spine look? Is it straight or is it curved from the side view? Curved, right? There's a forward flowing curve in your neck, there's a backward flowing curve in your mid back, and then again another forward flowing curve in your lower back. Now when the spine's in the right position, the brain is going to be able to send the electric and chemical signals to all the organs and cells and glands and muscles and tissues in the body as best it can with the least amount of interference, okay? So a lot of times when we sit at a computer too long or on the telephone too long, the cell phone, or we get in a car accident, or like I was telling you today, we wrestle or we play football, it's very common to lose this curve in your neck. Your neck either goes straight or reverses the opposite way. When that happens, that's a terrible amount of stress on the spine, the muscles, and most importantly upon the spinal cord and the nerves, okay? So this kind of a posture is not very good or healthy in the long run. So the ideal posture is to have the spine with its natural curves, okay? So the exercises that we're going to do tonight are designed to get the natural curves into the body. And the reason why that's important is because the spine was created to surround and protect the spinal cord and nerves, okay? And the nerve system controls and coordinates all the other systems in the body. So right now you're hearing me, you're interpreting what I'm saying, right? You're digesting dinner if you had dinner. You're fighting off infections and viruses and bacteria. And even healing comes from your nervous system. If you cut your finger or you break your leg, you never have to think about it. The body innately knows how to send messages down the spinal cord, out to the finger, heal a cut up or a broken bone. It all happens innately in the body. This wisdom that's in the body to run and heal itself is improved by having your spine and nervous system in the best position. Does that make sense? And so we want to get our spine and nervous system to as near to normal alignment as possible. Now, how do you know if your spine's in near to normal alignment as possible? What do we do? What do we check on you? Like today we took a digital picture of you and you can check the posture, right? And so that's very important because it has really nothing to do with how you feel, right? So somebody will come in and they've got a very far forward head or their shoulders low on one side and they might hurt, and in a week or two the pain goes away. But if the pain goes away in a week or two and the posture is maybe halfway improved, what do you think will happen to the pain as the problem worsens again down the road?
It'll
come back, or it'll get worse again, right? It's kind of like if you had braces on your teeth and you wore the braces half time and you took the braces off too soon, what would happen to your tooth?
It'd shift back.
It'd shift back, right?
So if you don't wear your retainer, they
you
shift
don't wear
back.
your retainer brace, it'll return back as well. So it's very important to get the spine and posture to as near to normal as possible and then maintain it or retain it, just like you wear a retainer brace, to keep it that way for life. Now the average person that comes to get adjusted here comes in anywhere from once a month to once a quarter to twice a month to once a week just to get checked, right? We check the spine to see how it's doing because the spine can actually get out of alignment or get stuck way before pain ever comes down the road. So it's a kind of a preventative thing to have checkups on a regular basis, just like the Dental Association recommends checkups every 2 to 4 times a year, depending how much plaque you make. Does that make sense? But first, we got to get you to as near to normal as possible, okay? And the way to do that is by having your chiropractic adjustments on a regular treatment schedule and doing your home care at home that we're going to show you right now. 50% of the correction is going to come from you doing your home care, and the other 50% is going to come from you getting adjusted in the office. Does that make sense to everybody? Okay, so come on over here, Jasmine. We're going to come over here, everybody, if you want to watch this table right here. Jasmine's going to lie on her back. Okay. And the first exercise, everybody's going to get a sheet of this tonight. It's called Dead Bug. Okay. Now I didn't make up that name, but that's what they gave it, because have you ever seen a dead bug or a cockroach on its back and its legs are up like that? Very similar to that. Okay. So the whole exercise starts with your mind on your core, on your belly, right? So if I was going to tell you to tighten up your belly, the good way to do that would be think about getting punched in the belly, right? So if I was going to punch you and you knew it, you would tighten up your core. So you want to have your thinking, your focus on your core, even though I'm going to ask you to do things with your arm and your legs, but your focus is on your belly. Does that make sense? Okay, so the first one she's going to do is this is the starting and stopping position. And if you forget this is on our webpage at drcasabona.com. You can watch a video of our staff doing the exercises. So what she does is she contracts her belly, tightens her belly. She lifts her one arm till it's straight up, and at the same time her leg till it's straight up, and then she tucks her chin down. She concentrates here, focuses for 2 seconds, keeps it tight till she goes down to this starting and stopping position. Then she relaxes and does it again. It's about that slow. Then she does another one, and like that. Does that look like it could do it? If you can't do that, we can peel that back and you can just do the arm or the leg first or not lift the head. So now we're going to go on to the belly. This one's called Dead Bug. Very good, Paul. So in this one, she's going to lie on her belly in this starting position, and she's going to lift up the opposite arm, the opposite leg, and her head all at the same time. She's going to hold it for 2 seconds, and she's going to do it again. Does everybody see that? Got that? So we're going to do these in sets of 10. We're going to do 10 and rest, and then we're going to do 10 again and rest, and we're going to try to get to 4 or 5 sets of 10, which is really important to warm up the spine before we go into what's called spinal molding. So spinal molding are these little blocks that are shaped to put your spine in its normal position. Those side curves that we talked about, the neck and the lower back. So this one, you see how it has a flat side here, and this side has a slanted side? Your head goes over the slanted side. So the slanted side goes towards your shoulders, and it goes at the collar of right where your collar would be in your neck. This one doesn't really have a top to bottom. This goes in your lower back, and this one goes right above your belt. So the belt and the collar is how you remember where they go. And S for slanted, S for shoulders, slanted side towards the shoulder. So she lies down on her back after she does the exercises. You got about 5 minutes before you get on here. And she's going to put that in her lower back. And then this one's going to go right at the collar. Can you see that, Serena? Mm-hmm. Then she bends her knees like this. And while she's here, what does she do? She breathes deep into her belly. Her hands are on her belly. She breathes in, her hands go up. She breathes out, her hands go down. And she just does that for up to 20 minutes, 15 to 20 minutes. But, I hope you guys are listening, this is started out at 1 minute. So you set a timer for 1 minute, you stop whether you heard or not. The next time you do it, like say you did a minute tonight, tomorrow morning you would do 2 minutes. And tomorrow night, how many minutes would you do? 3, and the next morning 4, and the next night 5, okay? And you're just standing here, lying here with your knees bent, very important, and breathing. Now say you had a shoulder problem. You can take your hand, make a fist, make small circles in the opposite directions, and then you can make a little bit of a wider circle in opposite directions. Say your hip bothers you. You can stick your foot out, and you can do a small circle on your left foot, inside, outside, and then a little larger circle. Just things to do while you're lying here, because sometimes you get bored. Or listen to nice music, pray, meditate, have the TV over here, listen to the news, whatever you like to do, something to get you through the time. But you gotta do this for 15 to 20 minutes to mold the spine back in its proper position. Does that make sense? If you get sore or you get pain down your arm or leg, you stop immediately, okay? Any radiating pain, any soreness that hurts you, you stop immediately and you tell me on your next visit. If you get off of there and you're sore, put ice wherever you're sore for about 10 minutes. Put ice, like a frozen freezer bag with a paper towel wrapped around it, and put it either in your neck or your low back or both after you get off of there. Does that make sense? Okay. So in this important time with this pandemic, chiropractic care is not a cure or a prevention of anything. Chiropractic gives the body an adjustment and gives the nervous system, the body, the best chance to respond and be as healthy as possible. There's certain people that get adjusted and they get diseases, and there's certain people that get adjusted and they don't. But it's all about being able to function at your optimum level and being able to live your life to your fullest potential. Okay, so it's very important to have these curves in your neck and your back. Not saying it's guaranteed to prevent anything, but we always say you're going to live a better life with the normal alignment than you would without it. Does that make sense? Okay. So if you guys have any questions, you can ask me after the video's off here, or if you need to look at this online, just go back in the DR Casabona and you can see it afterwards. I want to thank everybody for coming out. We appreciate your support, and we'll see you on your next visit.
So at home, we don't have this
You do it on the floor.
floor.
Unless you can't get